Hi, it's Brain Bites with Dr. B. Today I'm going to answer a question I got about a client who was on Lexapro. One of my colleagues reached out. She's a therapist and she has a patient had been on Lexapro for years. Lexapro is also known as escitalopram and it's an SSRI or a Selective Serotonin Reuptake Inhibitor. This patient had been on 40 milligrams a year ago and she had been having some side effects and was doing fairly well from a symptom standpoint and was decreased to 20 milligrams about a year ago. Now the client wants off the medication because she feels like her symptoms are under great control and she is having sexual side effects from the medication. Lexapro is also known as escitalopram, and this is one of the SSRIs that is generally really well tolerated. The FDA has the upper limit at 20 milligrams, but I often go as high as 30 or 40 milligrams to get a good effect, and it doesn't usually worsen side effects because it is such a mild medication. And with this medication, oftentimes when you go up in dose, it is more effective. Not all medications have a dose schedule like that. Sometimes medications may go off as you go higher, so higher isn't necessarily better. So when is it okay to come off of medication? So oftentimes when I'm starting a patient on medication, I set up what the expectations will be. In general, we try to find a spot where the patient is on a medication, stable, feels like they are back at their own baseline where they want to be, and then we maintain that on the current dose of medication for at least 6 months. Now, of course, if there are problems with the medication or patients having side effects or there's some other extenuating circumstances, that may be different. But in general, once they are 6 months stable on the medication, not having problems with symptoms, we can talk about coming off the medication. The main thing with doing this is that it must be slow. So when we take someone off a medication, we want to back it up really slowly in tiny, tiny increments over as long as pretty much the patient can tolerate. Some people feel so good and they just are like, I feel great, I'm better, I want off the medication. And that can set them up for failure. So to do it the right way, after we've been stable on the medication for 6 months, we have a discussion. Okay, are you ready to come off of the medication? How does that feel? Are you going to be okay? Let's talk through what could happen and let's talk about the plan of coming off the medication. So with Lexapro specifically, this patient was already down to 20 milligrams. So Lexapro runs in 5 milligram tablets, so it's pretty easy to come down by fives. So the recommendation I made to my colleague was that it would be appropriate to go down 5 milligrams at a time. Now, I don't recommend you give these specific recommendations to your clients if you're not a prescriber, but this can be something helpful that they can sort of understand what the process would be when coming off of a medication if they're just kind of tossing around the idea of like, I should just stop because I feel good. There is a right way to stop. Okay, so with Lexapro, we're going to go from 20 milligrams, and I'm going to recommend 5 milligram decreases, so 15 for a month. No return of symptoms, everything's going okay, go to 10 for a month. Now at this point, fives can be cut in half, so they could go to 2.5 increments. So depending on how well the patient had been doing, if there was any sense that things weren't going quite as well, even if the patient was pretty sure that nothing was wrong, I may go as slow as 2.5. So I might go to 7.5 and then 5 and then 2.5 and then stop. But in general, I usually run Lexapro in 5 milligram chunks. So 10, 5, off. That's a multi-month plan to come off of the medication. And this is a normal thing. We want it to go slow. So what happens if a patient or a client starts to have symptoms again? So the recommendation is to go back to the previously effective dose. So this often happens. I have patients who've been stable, they want to come off the medication, and we slowly start to back off. Sometimes patients may get to 10 milligrams of this specific medication, escitalopram or Lexapro, and then start to feel yucky again. They're like, I'm feeling anxious, my mood is not as good, I'm feeling irritable, things are just not going well. So the recommendation, let's go back to 15 and see what happens. In general, if a patient has been going really slow coming off their medication, that previous effective dose should take care of it. So the patient can go back to 15 milligrams, sit there for a few months. This is not something that we go right back down again. This is where we're going to try to stabilize again. So we try 6 months. Are we good? Did we have to go up again? Are we feeling like it's went back to baseline as expected? Baseline 6 months, you can try pulling it off again. Okay, so that's what happens if there's a problem. So when patients are coming off of these medications, specifically with Lexapro, this is a pretty mild medication as far as side effects go. Same thing with like a physiologic withdrawal. So this is not an intense thing, but with some SSRIs, there can be some more intense physiologic experiences when they're coming off of an SSRI, especially if they stop it like right away, cold turkey. So the main things that would cause is it can cause something that's referred to as zaps, brain zaps, or body zaps. So this is the experience that's been described, is that patients will feel sort of like a zingy sensation that either runs down their limbs or they feel it kind of in their head, like a zingy sensation. I'm told this is not a painful experience, but that it's sort of an unsettling, strange experience. So if the clients that you're talking to are coming off their medications and they're reporting these weird zappy things, it is a known experience that people have, and it should go away once they're completely off the medication for at least a few weeks. For most of the patients that I've had that described it, it's not the kind of thing that is very disruptive and very uncomfortable that they would go back on the medication for. It's more just something that's like strange and notable and clearly linked to coming off of this medication. So a lot of times people feel like they got better and they want to come off the medication. So I would just like to make the point that oftentimes people feel like they're better, but the medication may be a big part of why they're feeling better. Oftentimes, we'll see people take blood pressure medications and they say, well, I don't need my blood pressure medications anymore because my blood pressure is better. But probably a big impact of your blood pressure being better is that you're taking blood pressure medication. So that's one of the things that we're constantly looking at when we're looking at mental health symptoms. The idea of waiting until somebody's been stable on a medication for many months is really sound, because the way we think the medications work, there are all these levels in the brain that the brain maintains the homeostasis. So, turn this up a little bit, turn that down a little bit. Your brain tries to keep everything pretty even, pretty stable. But when we see patients that are on, anti-anxiety medications, antidepressant medications, something has been out of whack. And that's why we tried the medications in the first place. We give the medications, the patient seems to improve. We like to think that's from the medications, but we don't want to just pull it right away again. So the idea is that it took 4 to 6 weeks usually to see the full effects of the medication at a certain dose. So in the reverse, it's kind of the same thing. So I was saying we decrease the dose every month. That's pretty reasonable, because it can take 4 to 6 weeks for your brain to catch up. So we're talking about all the neurochemicals, all the different molecules, the different receptors that have to be built, down-regulated, up-regulated, all these different things that happen in the brain when the levels change. So what we're doing is making sure that that process can keep up with the changes that we're doing with the medication. In theory, once the patients are coming slowly off the medication, if the brain is doing what it's supposed to do, all of those chemicals will be balanced by the brain. Like now it can self-regulate and keep the levels where they need to be so that the patient can maintain their stability. So if we go slowly enough and the brain is able to keep up, that should be their new set point and everything should be okay. So that's the good piece. That's the thing that we want to have happen. So if this process goes too fast, there's a couple things that could happen. So if patients stop the medication cold turkey, like I mentioned before, they can have some physiologic withdrawal symptoms. They're usually not too bad, but it's still not something that's desirable if we can do it slowly and avoid the whole thing. But oftentimes what happens is there are rebound symptoms. So this can be really problematic. To just take away that chemical from the brain suddenly, there's not time for it to recalibrate what needs to be done for those levels in the brain. So it doesn't have time to catch up to all the changes that will be made from going from 40 milligrams, say, of Lexapro to 0 milligrams. So that's a really big change. Those rebound symptoms mean that they could be as bad or worse within a few weeks of coming completely off that medication as when they presented in the first place. So this is something we really want to try to avoid. The other piece of that is that once they come off that medication really fast and they have those rebound symptoms, it can be even harder to treat that episode the next time around. So even if they just go back to the same dose they were on before, it may not provide the same effect as it did when they were stable on it. So then we're playing catch up again and trying to figure out where is the dose that we need to be to maintain this patient's stable symptoms. Never mind that it can be pretty demoralizing to go off medication, then need the medication again, and then have it not work the way it did before. We try to avoid that as much as possible. So if you do have a client who comes to you and is like, I'm better, I want to go off my meds, I've stopped them this weekend and I'm not going to take them ever again, that's something where you can intervene and say, hey, wait just a second, like, you should probably reach out to your doctor. You should probably take your medication until you talk about a plan to come off of the medication. The other thing that's tricky is that because there's that lag, like we were talking about before, there's a lag to get well, there's also a lag in the reverse. So just because you stop the medication, you don't feel bad immediately. It's not like when you stop blood pressure medication with a couple days, your blood pressure is totally out of whack again. If you stop a medication like an SSRI, it's going to be a couple of weeks in most cases before things start to fall apart again. And that can be tricky because the medication, when they stopped it right away, they felt good for a little while after that. But this is an expected experience. If they stop a medication and they don't get what they need, the symptoms will return with a vengeance sometimes. So that's not something that we want to see. What we want is slow, progressive decrease in dose so the brain can keep up and we can catch it. If it starts to seem like it's not working quite as well, we can go back to the previous effective dose and sit there for a while and see how it goes. So this is not something I recommend to all of my patients. Just because somebody gets on medication and feels better doesn't mean they should automatically come off the medication. So the main two scenarios where I don't want people to come off of medications is if they have really significant suicidal or self-harm thoughts that the medication helps with. That's a period of time where we might do a trial and see how it goes. Maybe there is a lower dose that can still be effective, but it's very tricky to pull medications away from those patients if it's treating some of those suicidal thoughts. That's somebody that I'd like to see probably stay on medication long term. So the other scenario that I really don't want people to come off of medication if they can help it is somebody who has repeated pretty significant episodes. So someone who suffers from depression and gets, maybe a really bad episode once a year, that's somebody that every time they have an episode, they're going to need the medication. It doesn't have to be super predictable for me to want to keep them on medication, but if we know it's significant and it's coming again, the idea that it can be harder to treat each episode as they come is enough for me to want to keep the patient on the medication, especially if it really limits the amount of severity of the symptoms when they do get depressed again. So other stuff that I kind of play it by ear depending on the patient's specifics is I'm really careful with panic disorder and OCD. If those patients have really good responses to the medication, I'm much less likely to pull the medication off or tell them up front that we will probably get off the medication. Those are patients that tend to do better on medications longer term if they get a good effect from the medication in the first place. So if your client comes to you and wants to come off of medications, now you have a little bit of information that you can give to them to help them kind of make that decision is now the time. And then, of course, refer them back to their prescriber so that their prescriber can come up with a plan to come off the medications. But it's also nice to get a little insight into why a patient wants to come off of medication. Maybe this is a client that's looking to have children. So that's a different discussion that we would have about whether or not it's a good idea to come off of medication because you want to get pregnant. Is the insurance running out? Are they worried about paying for the medication or staying on the medication if they don't have a regular prescriber? These are all things that a little bit of digging into why a patient wants to come off of medication can provide a lot of helpful insight in the direction the conversation needs to go. So this is something that I talk to patients about upfront. I want to set a precedent so they have expectations of, hey, hopefully you'll feel better. We're going to get this going. It's going to be great. You're going to want to go off medication right away, but I'm going to tell you to stop. Stay on the medication for a little while. Let's come up with a plan to pull you off because nobody wants to be depressed again. Nobody wants to struggle with that spiraling anxiety. So if we can head this off up front, if we can address it in the beginning, then reminding the patient on a regular basis, like, hey, this is good. Like, you've been stable now for 3 months on this medication. Perhaps in the next few months, we can talk about whether or not we want to come off. Now, one of the other things about timing this is that if they have an anniversary date coming up, a traumatic event, something like it's going to be right in the middle of the holiday season where things are very stressful and busy, I might push it back a little bit. We want to minimize the external stressors that a patient may experience that could worsen their symptoms, even if their brain is keeping up with the regular stuff. Well, hopefully this case has been helpful. This doesn't only apply to Lexapro, it does apply to many of the SSRIs, but there are nuances to each one of those medications. So dosing may be different, the scheduling may be a little bit different, but the idea is to go slow and take as long as a patient can tolerate to come off of the medication. This has been Brain Bites with Dr. B.